All right, it's 2 o'clock. We will go ahead and get started. Once again, thanks for joining. My name is Lindsay Heck, and I'm a program associate here at the Iowa Cancer Consortium. I'll turn my video off in just a little bit, but I just want to put a name with a face. I do manage the grants processes here at the consortium. So if you've applied for our boost grants or any grant process that we will have, you'll be in touch with me. So I just want to say hi and put a name to a face, but I will go ahead and get started. So I'll turn my video off and it'll be a PowerPoint presentation. Give me just a second to get set up here. Okay, so we do have a chat box available on Zoom, and we also have a question and answer box. So if you have any questions during the presentation, please feel free to submit those as you have questions, and I'll try to get to those as soon as I can. And we also plan to have time at the end of the presentation for questions afterwards. I just ask that if you do have any questions that are specific to your project, please reach out to me privately at your convenience. And don't hesitate to reach out to me via email or phone if we are unable to get to your question at this time, or if you have a question that may come up when you're completing your application. So today's webinar will be recorded, just so you know, and we will let you know when the link is available for viewing after. I just want to thank you again for joining us. And the purpose of today's webinar is to review the fiscal year 19 Iowa Cancer Plan Implementation Grant Opportunity. We'll cover the basics of the grant today, talk about some of the changes from previous years, and provide tips that will help you make your application more successful. Please keep in mind, I know everyone's busy, but our staff is happy and available to help you in this process. You can reach us at staff@canceroiowa.org, or you reach out to me at heck@canceroiowa.org. If you're not familiar with the consortium or would like a refresher of who we are and what we do, you can take a few minutes to look around at www.canceroiowa.org. And all of our grant information and documents are available at canceroiowa.org/grants. We're going to go through a couple basics about the grant. These grants are intended to fund collaborative projects that address identified gaps in Iowa's cancer prevention and control efforts. And successful grant applications will incorporate goals and action steps from our newly released 2018 to 2022 Iowa Cancer Plan, which you can view on our website, once again, canceroiowa.org. And the Iowa Cancer Plan outlines priorities, goals, action steps, and data targets for cancer prevention, screening, treatment, quality of life, and health equity in our state. The entire plan is available on our website. Your cancer plan grant application must specifically relate to at least one goal and action step from our new plan. And the project period for our applicants will run from July 2nd of 2018, so that date is wrong, I apologize, through June 1st of 2019. You can apply for up to $25,000 in funding, and there is no minimum application amount. Our average grant that we do give out usually ranges from $10,000 to $15,000. The more funding you request, we do ask that you provide some more evidence to show off your need of your project and how effective it will be for that amount of funding. And the number and dollar amount of awards is dependent upon the funds that we have available and the number and scope of proposals that we receive. We do have separate applications for single and multi-year projects, and multi-year applicants must reapply each year for their grant funds. It is important to show progress towards year one goals and objectives as all applications are considered to be on a level playing field. Multi-year projects can apply for up to 3 years and for up to $25,000 each year. So when you're completing a multi-year application, you should identify objectives, action plan steps, and a budget for each year of the funding that's requested. And when you go on our website to access our grant applications, we do have a separate link for the multi-year documents, and that includes each year separated in the application, so you're able to complete all that information. Funding will be reviewed annually based on tentative site visits that we will offer, project outcomes, and available funds that we have. We'll go through a couple of things that are new this year. So the first thing that we do have new actually was from our boost grants that we offered, and that was application completion and timeliness scoring on our rubric. We consider an application to be complete when it's combined into one PDF document. All sections and questions are answered. Resumes are included if staff support is requested for funding, and the budget is accurately calculated, and a letter of support is included from each collaborator on the application. And once again, although we say that projects are submitted on time projects are submitted on time but are not complete, we do accept those, but you will not receive the completion scores for that. And no late materials or applications are able to be accepted at this time. And along with our new cancer plan comes new priorities. So our priorities areas this year for our grant applications are health equity and access to prevention, screening, treatment, and quality of life. So we do have definitions for what we mean by health equity, access, health disparities, and those are on our application documents as well as the rubric, and points will be assigned on the rubric to addressing health equity and access. So here's the example of a little cutout of our definitions that we provide to you from Healthy People 2020. So what we mean when we say health equity, health disparities, and access. And also an example of where we have the rubric kind of points outlined for you with how well we think your application meets the need of addressing health equity and access in Iowa. We don't require you to be a member of the Iowa Cancer Consortium to apply for an implementation grant, but we do offer that, and we would really love to have you as a member. We found that other grant applicants who have become consortium members have found their membership to be valuable in their grant project work and other cancer control work, because we do offer networking, collaborative opportunities, and meetings throughout the year. Our dues are very low, and we do offer full scholarships as needed, and you can email us at staff@canceriowa.org to request one. And we have a link for membership information on canceriowa.org if you'd like to learn more about that. Some additional requirements for our applicants. Your project activities must occur within Iowa and must serve Iowans. All activities that receive funding through an Iowa Cancer Plan implementation grant must be entirely tobacco-free. We do not allow any sort of tobacco to be aligned with our project. So if you do have, say, a community event, it has to be completely tobacco-free. There can be no smoking on the premises. Grant funds may not be used to replace dollars that are currently earmarked for cancer programs and projects. Funds may not be used for lobbying, and they may not be used to cover indirect costs, which may include administrative or overhead costs. And funds may also not be used for clinical care, which includes the provision of medication, vaccination, and/or treatment. Other things that you should consider when you're completing your application are incentives and service delivery. Incentives are an allowable expense only if proven to be effective as part of an evidence-based intervention. The evidence base must be explained, and a statement of need is required to explain the request. Service delivery, such as radon mitigation and screening test purchases, will be heavily reviewed. Community organizations and collaborators are encouraged to provide financial support for service delivery components. So our first requirement or the first step towards submitting your application is submitting a letter of intent. This does not have to be extensive in any means. We do provide a sample on our website as well as within the application documents. There is a link to one. This is more for us to kind of gauge how many applications we'll receive and to kind of make sure that we do have enough external reviewers to meet our need of applications. These required letters of intent are due electronically to me by 5 p.m. Central Time on Friday, March 30th. You can just send me an email, heck@canceriowa.org. And they are required in order to submit a full application, just so we ask that we are prepared in terms of reviewing the grants when that time comes around. Again, it can be very simple. Just tell us that you plan to submit a full application and identify the goal from the Iowa Cancer Plan that your project will address: prevention, screening, treatment, quality of life, or health equity. And your project can align with more than one priority from the cancer plan. Again, you can view the document within the application documents. There is a sample, and if you have any questions, don't hesitate to reach out to me or send me an email for your letter of intent. Again, March 30th is the deadline, so you do have just about a week to get that into me. We do have assistance that we will offer in person at our upcoming regional spring meetings. A subtle plug that we do have registration open for those events, and they are free for members, so we really look forward to meeting you there. If you would like additional assistance during these times, just send me a quick email or any of the staff an email, and we can set up a time just to make sure that we are able to sit down and meet with you one-on-one in person and go over your application, any questions that you may have. Now we're going to focus on the actual application here. The first part of the application is the project description, and it's your opportunity to really explain your project. This section will identify your target audience, quantify your project's reach, and explain why you or your organization is a good fit to carry out the project that you're proposing. We also ask that you explain how your goals will be met in carrying out the project. It's important to be as specific as possible. We don't have any sort of minimum page requirements or maximum page requirements for our grant applications, but just be as specific as you need to be in order for us to kind of learn more about your project. And of course, you are the best sort of source of knowledge for your project. We don't know that much about it, so it's the best to kind of allow our external reviewers and staff when we're reviewing your applications just to know as much as we can about the project in order to really give you the best opportunity to be funded. And as we are a collaborative organization, we ask that your implementation grant application and project be as collaborative as possible. All applicants must have at least one collaborator on their project, and a letter of support is required for each collaborator that you have. And your final application, which is combined into one PDF, should include letters of support from each of the collaborators that you have. And there is a link and a sample in the application documents and on our website for you to take a look at. Feel free to share that and use that exact template if you'd like. So once again, at least one collaborator is required, and a letter of support should be included from each of your collaborators that you have. So now on to project objectives. We follow the SMART project objectives template. So we believe that the objectives are really the muscle of your application. They kind of outline what you really strive to achieve in your project and what your goals are. And what we think is that weak project objectives could cause an otherwise great project to not get funded. There is scoring on the application with regards to actually outlining the project objectives in SMART format. And what we found in previous years is that applicants were not scoring well on that part of the application, so we have kind of redesigned the application to reflect that. So what we mean when we say SMART project objectives, we're looking at the specific part of the objective. So who, what one action will be completed and who is responsible for getting that done. M stands for measurable, how much of a change is expected, and how will you know that that change has occurred? How will you be able to show others that that change has occurred as well? The A stands for achievable. Is the objective possible to achieve, especially within the time that you do have, whether it's a single year project or a multi-year project? R stands for realistic. Are you and your collaborators able to meet the objective within the grant timeframe and within the available resources that you're proposing? And T, time bound. When specifically will your objective be met? So within the application, we do provide a specific example here. So we're saying our example, the Iowa Cancer Consortium will increase the number of IFP grant applications received from blank fiscal year 2018 to blank fiscal year 19 by May 11th of 2018. So within the application under objectives, we'll ask that you pull out each detail to ensure that you're really meeting the SMART objective requirements within the objective. So for our example, for specific, the Iowa Cancer Consortium staff and board will announce the IFP application to members and contacts. That's how we're meeting this goal and who is actually doing it. For measurable, we're looking for an increase in applications received from blank to blank, an increase of blank percent. So really show us, how much change is expected. Data helps here, goal data and a change in rates can be shown as well. A, we said, stands for achievable. So consortium staff, board, and grant reviewers have the capacity to review this many applications, which occurred most recently in fiscal year 2016. So compare it to either past projects, maybe in your community or another community, and really show that this project is achievable. The R is realistic. So the consortium received this many applications in fiscal year 2016. In order to return to that many total applications, consortium staff have reached out to this many new contacts and have offered diversified outreach across the state through spring meetings, the Iowa Cancer Summit, and capacity building webinars. So we're outlining the steps that we have made in order to increase the number of grant applications that we receive. And finally, time bound. We have a deadline of May 11, 2018 when your proposals are due. So once again, the SMART template is completely outlined in your application, and in order for you to really achieve those points that we have listed on the rubric, we've outlined the SMART objectives and asked you to pull out each piece just to make sure that you're meeting the requirements there. Something new again for this year is addressing health disparities and equity, which we mentioned is scored on the rubric for this year. This section asks how you define how you are working towards health equity. and to consider your plan to reach communities that are affected by disparities. Again, we do offer the definitions here so you really understand what we're trying to get at, and we just ask that you answer those questions and feel free to use the resources listed in order to learn a little bit more about either health disparities or health equity in cancer control and prevention. And our second new priority is addressing access within Iowa. We do have a couple resources listed here as well, along with a definition for access. Let's see, and we do have the same questions listed under access, and it's we do offer additional points for addressing access to prevention, screening, treatment, and quality of life services within Iowa. So that's a broad topic. Don't hesitate to reach out with me with questions, because this is quite a broad topic that we do offer priority for. And here again is the example of the rubric, the scoring for addressing health equity and access in your application. And evidence-based. So throughout your application, you'll be asked to explain how your project is evidence-based. And this simply means that there is scientific evidence to support the activities you identify in your application and how they will actually lead to the desired outcomes that you have set in your objectives. The application documents include links to several resources that can help you develop evidence-based goals and objectives. And these include the community guide, research-tested intervention programs or RTIPs, research to reality, and scholarly journal articles. And we do also offer the link to this YouTube video from the College of Public Health at the university. And it can really help you walk through the process of using evidence-based practices. Evaluation of your project. So what we're really trying to get at with evaluation is understanding if you actually met your objectives and if your project was successful in meeting those objectives. We do offer assistance, again, at our spring meetings, so definitely come out for those and register on our website. Your project evaluation simply identifies how you will know if your project worked or not. This can include attendance counts, doing pre and post or follow-up surveys, and asking participants if you met your goals. Don't forget that you can request in-person support as well. And again, reach out with any questions, since each project will be very different. If you have any questions related to any part of your application, we're really available and happy to help out, so don't hesitate to reach out to us. The next section is the project budget, again with multi-year applications. Each budget will be separate for each fiscal year that you'll be running your project. And we have considered what is an allowable expense, which is included in your project instructions and guidelines. Again, as we mentioned before, grant funds cannot be used to replace dollars that are currently earmarked for cancer programs and projects, for lobbying, to cover indirect costs, again, like administrative or overhead costs, or for clinical care or treatment. And funded activities must be completely tobacco-free. Our board does accept requests for equipment over $5,000, but those requests will be heavily reviewed and must be thoroughly explained and justified in your project. And incentives, again, are an allowable expense only if proven effective through evidence-based interventions. And the evidence base must be explained, and a statement of need is required to explain the request. Service delivery, we mentioned before, radon mitigation, screening test purchases, anything like that will be heavily reviewed, and we do welcome collaboration and to receive outside financial support or in-kind support for those parts of your application. We do consider staff support requests if the support is over and above what is usually required of the collaborative partner. And we do ask if you request staff support in your budget, you are required to submit a resume or a CV for that staff member, just so we can kind of address that the person that is being funded in the grant program is qualified to do so. If you are submitting a multi-year project, you'll be asked to draft a budget for each project year, again, like I mentioned. And this is outlined in the instructions document, which is incorporated into the same application document on our website. Please be sure to check the totals. That's included in the completion and timeliness score on your rubric. So adding your budget accurately is scored. And reach out with any questions that we may be able to provide in-kind support for. So this could be anything from registration services with the university to any kind of webinar, offering our Zoom conferencing webinar, which we are on today. We will try and do that. And we do have a question here from Julie. Hi, Julie. For multi-year projects, for those of us who wrote for 3 years last year, are we to just write for 2 years again this year, or when we expand out, or may we expand out to 3 again? Excellent question, Julie. I did reach out to you with a separate application for just the 2 years that you'll be able to write for. So within the length of the 3 years that your program is running, it will be the second year, and then next year will be the final year that you can apply. So hopefully that answered your question, that you'll be applying for just 2. Great, thank you. Again, reach out with questions. We really hope that we can support you guys and our members and contacts in any way that we can, because we truly are collaborative and would really love to assist in any way that we can, and that would be in-kind support. Within the budget, we do consider in-kind support, and the board and external reviewers do consider in-kind support to be highly valued, that you do have collaboration with other organizations or within your own organization to receive support that way. Again, reach out with questions. We're happy to help. We really, really are. Let's see what is up next here. Okay, so reviewing is just about the same as last year. Funding decisions are made based on external reviewers. So once your application is submitted, the deadline is May 11th of this year. That's a Friday. We as staff will review your applications for completeness and accuracy. So we will score the application completion and timeliness for our reviewers, just to make sure that they are informed of, you know, how complete your application was and if everything is kind of in line, and they will receive the entire package. And then we will have anywhere from 3 to 6 external reviewers rate each application, score, provide comments. And finally, our board of directors will make final decisions based on the scores, priorities, and available funding that we do have. So again, those are externally reviewed. And here's our final timeline here. So March 30th, again, next Friday, your letters of intent are due to me, heck@canceroiowa.org at 5 p.m. or by 5 p.m. ideally. We do have the application assistance coming up very shortly in our busy month of April, April 6th, 20th, and 24th. April 6th, we are in Council Bluffs, Iowa. April 20th, we are in Ames. April 24th, we are in Dubuque. And again, reach out to me and we can set up a time to meet, just so that we are able to set aside time that we can meet one-on-one. Your full proposals are due by 5 p.m. Friday, May 11th. And June 22nd is when we're tentatively mentioning that we are going to give you award notification. And again, that is tentative just because we are not aware of our current funding for next year. So that's kind of in pencil there. We may have to make edits to that, but we will reach out to you and keep you informed of what our timeline looks like when that rolls around for us. And July 2nd is a Monday, and that will be the project period beginning for our applicants. And again, we're here to help. We really would love to offer as much assistance as we can. So on our website, under staff, you can see all of our phone numbers and emails, and don't hesitate to reach out with us any questions that you may have. Again, I've done our best to include the links for all the resources I've mentioned, and we will share this webinar with you and along with all of our members that request it. Are there any questions that I can answer at this time? You can raise your hand on the bottom toolbar for Zoom, or also type into the chat or the Q&A. So I'll just pause for any questions that you might have. Let's see. Hi, Allison. I think you may be able to talk, hopefully. Allison, are you there?
I'm here. Can you hear me?
I can hear you. Yep, go ahead.
Oh, okay. I was wondering if you could repeat a couple of the details about the project description part of the application. You seem to mention quite a few helpful details that I didn't actually see listed in the application itself, so I was trying to write those down as fast as I could.
Oh, sure. Let me go back to that, actually.
Thank you.
Okay, I'm just going to mute you for just a second here, okay?
Okay.
Okay. Oops. There we go. Okay. Okay, so the project description is kind of your opportunity to really explain your project to us. We're asking you to identify target audience, your project's reach, and explain why your organization is a good fit to carry out the project, and also explain how your goals will be met in carrying out the project. And again, I mentioned that really being as specific as possible. You're kind of the subject matter expert on your project, but our external reviewers, the staff that we have here and the board, we're really not. We'd like to think so, that we really get to know your projects, but the more information that you can provide is definitely helpful for us, so that we can really understand your project and, you know, answer any questions the board may have, because we do read every application that is submitted to us, and we answer questions from our external reviewers. So, you know, feel free to explain as much detail as you think you need in order to get the entire kind of project description, offer that description to us. I'm trying to think if I have anything else that I mentioned here. Yeah, so let me see, stop sharing here. Allison, did that answer your question?
Yes, that did. And is the limit 500 words on that?
I don't, let me see. We do have a suggested length, but we do not set any sort of upper limit for that. So as much detail as you need to provide or would like to provide to us, we're happy to welcome.
Okay, thank you very much.
Yeah, no problem.
Hey, Lindsay Heck, you have a question in the Q&A.
Oh, Q&A. Oh, Kelly, so Kelly Handershot asks, are you using Zoom webinar or meeting? Just a little curious about the differences, if any, in presentation options. So Kelly, thank you for your question. We are using Zoom webinar, so it's a little bit different in that most of the attendees you guys are muted upon entering the webinar room, and only panelists can share their video. So unfortunately, I can't see you guys in order to share my screen on webinar. But this is a new format for me for sure, so I'm sorry for any technical difficulties you might have experienced. Any other questions? Or Kelly, did I answer the questions? I can turn my camera back on here, Julie. Let's see. Once I figure this out, here we go. Okay, I'm back. Okay, Kelly Hendershot, great, and Zoom webinar is acceptable for educational outreach. Yes, it is, Kelly. Thank you for asking that question. We do offer, you know, you can put in a request to us if you would like to use our Zoom webinar or conferencing software. Again, we do not have HIPAA compliance with our Zoom portal and program that we have, but that is an available option if anyone is interested in Zoom software for their program. They do offer an additional package that you can purchase in order to be HIPAA compliant for your projects. Any other questions for anyone or any comments?
It looks like maybe Kelly wanted to answer the question live. I don't know. Kelly, we could unmute you, I guess.
Kelly Hendershot?
No, I think Kelly Siddig.
Oh, I don't see that.
I'm in the Q&A, so maybe that's why. I guess.
Okay.
Hey, this
I'm
is
sorry.
Kelly.
I apologize for technical difficulties. Kelly, are you there?
Can you hear me?
Yes, I can.
If I raised my hand or put something in Q&A, it was by accident.
Okay.
Sorry. Thanks.
No problem. Any other questions that I can answer? Again, don't hesitate to reach out to me. Email, telephone, I'm available as I possibly can be. I'll try and get back to you as soon as I can. All right, we're ending a little bit early today, giving you back some time for your day. I just have a couple more things to mention. Again, my email, heck@canceriowa.org, HECK as in what the heck at canceriowa.org. Thank you again for participating. We really appreciate that you guys are here and submitting applications for our grants. Some upcoming opportunities that I'd like to mention as well, some plugs for our fellow staff members that are coordinating these projects. Our 3 upcoming spring meetings, as I mentioned, are right around the corner in April. And again, we offer the one-on-one application assistance during those times. And we do have an upcoming capacity building webinar that is free for our members, $5 for non-members, Wednesday, April 18th. And we will discuss how tobacco is more than just a public health issue. And Beth Turner from the American Lung Association will be giving that presentation. You can find the registration details on our website, canceroiowa.org. And we will just watch for your letters of intent by 5 p.m. next Friday, March 30th. And in the meantime, again, don't hesitate to reach out with questions. Again, I'm totally beating a dead horse here, saying don't hesitate to reach out, but really, if you have any questions, there is no dumb questions. Please just reach out with anything, any comments or suggestions for next year's application. We're happy to welcome those as well. So any other questions before we end our webinar today? You can check the Q&A here. Lindsay, thank you for putting my email in there, and I'll also put my phone number in the chat box.
No problem.
All right, I don't see any additional questions, but if you do, again, email me, give me a phone call, or any of the staff members here. So thank you again for joining, and we'll provide the link to this webinar as soon as we are able to edit the video. Thank you, guys.